So anatomical position, it's a neutral position. And this position, eh, the body is viewed as standing erect. You can see the standing erect. This information you'll find in my handout that I uploaded into the chat. So this position described as an standing erect. You can see the standing erect. And if you can see the arms, these are the arms, the arms at the side. If I can write the arms at the side, and you can see the palms of the hands, the facing forward, right? The palms of the hand facing forward. You can see the palms of the hand facing forward. And what about the feet? You can see the feet side by side. This is an anatomical position, which is a neutral position. So how can we explain this position? It's the neutral position. The body is viewed as standing erect. You can see the standing erect. And the arms, these are the arms side by side. And the palms of the hands facing forward and the feet side by side. So this position is anatomical position, which is a neutral position of the body. Okay. Now, the anatomical direction, when describing the anatomic structure, describing any anatomic structures in the head and to the trunk of the body, the following terms are used, like anterior. Anterior means, what is anterior? Front. Posterior is the behind or back. Anterior and posterior. Then superior is above. Inferior is below. Superior, inferior. And the middle is the medial. And the lateral is the lateral. And the proximal means near, and distal is away. So these are anatomical direction. Okay. Now you can see here, this is anterior and posterior regions of the body. Again, I mentioned when describing the anatomical structure in the head and trunk of the body, the following terms are very similar. Cephalic. It's very important for TEAS exam, this slide. Cephalic means, cephalo means, can you remember medical term? Cephalic, also called head.
Head.
Correct. Cranial is the skull. Cranial is.
Go back to the previous slide.
Sure.
Thank you. Come forward.
Welcome. Cranial is the skull. You can see the skull bone. Cranial is also important term. You can see the similar meaning. The following terms are similar meaning. Cranial means the skull. The facial means the face. You can see the facial. Cervical. Cervical means the neck. You can see the neck of the area we call cervical or neck. Now, axillary is the armpit. Axillary is the armpit. The brachial means the arm, brachium. You can see the biceps brachii. If you can recall, bio 110 is a muscle. So brachial means the arm. Antecubital, front of the elbow. You know the antecubital vein. So which is the very important vein to collect the blood. So antecubital means front of elbow. Antebrachial means the forearm. You can see this is the forearm, antebrachial. The carpal means the wrist. Now the palmar or palm. You know, the palm of the hand is the palmar. The thumb is called the pollex.
Ciao.
So the digital or phalangeal means the finger. You can see the digital or phalangeal means the finger or toes. You can see the toes. So sometimes you'll get questions on these exams, similar meaning. You can see the digital or phalanges. It's a similar meaning with the dorsum. Dorsum means top of the foot. So, or even the digital or phalangeal means the toes. So the phalanx means the toes or fingers. So these are the very similar in meaning. The femoral means the thigh. Patella means the front of the knee. The crural is the shin. This is important, the pedal. You can see the pedal means the foot. So sometimes you'll find a questions in these exams. For example, the phalangeal structure may be pedal. Pedal means, okay, let me give an questions here. Look, the, the what is phalanx? Phalanx means, what is phalanges? The phalanges means the toes. Now, the questions, the phalangeal structure may be pedal. Pedal means on the foot, or manual means on the hand. So it's a very common questions. The phalangeal structures may be pedal. That means maybe on foot or in the hand. Is it clear? Please, these questions are very common. If I can clean this one,
So
this is
phalange,
very common.
so
You can
phalange,
see the yes. You go ahead, please. The
phalangeal doctor is toes or fingers.
fingers, yeah.
And if they're
So
being
the
specific, they'll say
maybe on the pedal. Pedal means on the foot, or
mm,
manual means the hand. So the
okay.
phalangeal structures may be into the manual or into the foot.
Okay, thank you.
So this type of questions you'll find in the TEAS exams. So because you know the manual also called a hand, so the phalanges are on the hand, and you can see the pedal means the foot, so toes are onto the foot. So that's why these type of questions are common. Now you can see here, this is the anterior view and the posterior view. Posterior means, what is posterior?
Back.
Back. Now you can see here, in the anterior view, for example, you can see the nasal cavity. This is the nose or nasal cavity, which is the anteriorly. Even you can see that ocular region. Oculo means, what is oculo? Oculo means eye.
Eye.
So you can see this is anterior regions. So, and this is the posterior region. In the posteriorly, we can see some occipital bone or the skull bone on the posterior. And you can see the scapula also called on the shoulder blade, which is on the posterior. We cannot see this from anterior side. The vertebral or spinal column on the posterior, and the lumbar, you can see the lumbar or the loin on the posterior. So this is the posterior view, and sometimes you'll get questions. Sometimes you can see the lumbar and dorsal. You know what is dorsal? Dorsal means back, correct?
Towards
Back.
the body.
In the back, correct, towards the back. So the lumbar and dorsal likely to appear in the same discussions. Can you see? The lumbar is on the back and the dorsal means back. Therefore, dorsal and lumbar to appear in the same discussion related to a part of the body. So you can see the relationship. Sometimes you'll find dorsal and lumbar. That means appear in the same discussion related to a body part. So in these exams, you'll find this type of questions too. For example, which two terms are likely to appear in the same discussion related to the body part, like lumbar and dorsal. Dorsal means back, and the lumbar is also into the back. So these are the same discussions. So the gluteal area means buttock. Uh, Popliteal means back of the knee. You can see the popliteal. Dorsal means the calf. So these terms are similar in meaning. So and used interchangeably. We can use this term interchangeably. Plantar means the sole and calcaneal is the heel. So this slide is very important. At least one question you'll find sometimes in exams. I'll give some review questions today from on these slides. Okay. Now the anatomical plane. I think you learned in Bio 110 and also in the what I said in the medical terminology. So what is anatomical plane? These are imaginary plane, and this anatomical plane are frequently used in diagnostic imaging. You know the diagnostic imaging. Can you give any example of diagnostic imaging?
Is the
MRI.
mammogram one of them?
MRI. Mostly we use MRI, and also in and surgery. So diagnostic imaging and surgery, we can use this imaginary plane. So what are the imaginary plane? The first, the mid sagittal. So what is mid sagittal? It's a vertical plane. You can see it's a vertical plane, and that passing through the body and dividing the body onto the medial and the lateral half. That means into the right and the left. So this is your what I said is the uh, sagittal that divide the body right and left half. You can see the right half and the left half of the body. So that is sagittal or mid sagittal. It's very important plane. Now the transverse. So what is transverse plane? This plane uh, dividing the body into superior and inferior. Superior means what is superior? Above.
Above.
Inferior is the below. So this is the transverse plane. So mid sagittal divide the body right and left, and the transverse plane divide the body superior and inferior. And coronal or frontal. In the coronal or frontal plane, that dividing the body into anterior and the posterior. Anterior means the front and posterior means the back. So these are anatomical plane, and this plane are frequently used in diagnostic imaging and the surgery. So very important, mid sagittal, the transverse, and the coronal or the frontal plane. Okay. So you can see here the frontal or coronal. This the frontal or coronal dividing the body into. Can you please answer? This plane dividing body into anterior and
Posterior.
anterior and posterior, front and to the back. Good. The transverse dividing the body. This is the transverse.
Superior,
And inferior.
Superior and inferior. Good. And the mid sagittal, you can see the mid sagittal dividing the body right
And left.
and left. Is it clear about the anatomical plane? Okay, now let's see the importance of the anatomical plane. Look, you can see here, there are the three images, A, B, and C. When we take the MRI or surgery, you can see here the three plane. Now, can you explain this plane, which dividing the body, brain, right and left half?
That's
Right and left. Yes.
That's
The first one is
The
mid-sagittal.
autonomous plane.
Mid-sagittal. Good.
Mid-sagittal.
Either right and left half. Good. You can see the mid-sagittal. Number B, you can see the dividing the brain above and below.
Transverse.
Superior. Yes, either transverse. And can you identify this one? Dividing
Coronal.
Yes, coronal, anterior and posterior. So this is coronal. And you can see when MRI, the physician asks all the section mid-sagittal, you can see that certain structure of brain we can clearly identify. But in the transverse, the different types of structures can be identified. And this is then frontal or coronal, the different types of structures. So this is the body plane. Now the body cavities. So the human body, if you can see from external, it looks like a solid materials, but the human body is not a solid. Inside the human body, there are many cavities. So now you will learn the cavities in the human body. I'm sorry, near my house, there is some rail station. We'll get some. Oh my God. Okay, let me close my own. Okay, now I think it'll be fine. So the body cavities are ventral cavity. What is ventral? Ventral means what this ventral means? Front. And the dorsal cavity means the back.
Back.
Now let's see the back cavity. The dorsal cavity includes the cranial cavity. We discussed earlier, cranio means, what is cranio?
brain.
The skull. Crania means skull. Cranio means skull. I think we discussed earlier. That is the skull. And the cranial cavity, the space inside the skull, you can see the space inside the skull, and this cavity protects brain. And a spinal cavity inside the spinal column, and the spinal cavity protects spinal cord. Good. Now, in these exams, sometimes there will be questions, the specific location of cranial cavity. So the cranial cavities are, that is the dorsal cavities, and the ventral cavities are divided into thoracic cavity. Thoracic cavity means?
Chest
Thoraco means
cavities.
chest cavity. And can you please name the structure here? Let me draw the structure in between thoracic and abdominopelvic cavity, the red colored structure. Do you know the structure?
Is it diaphragm?
Absolutely
Diaphragm.
correct. Absolutely correct. Good. Diaphragm. P-H-R-A-G-M. Now, there are some questions. What is the anatomical relationship between thoracic cavity and the diaphragm? Now you can see the thoracic cavity is superior to the diaphragm, superior to the diaphragm. And what about abdominopelvic cavity? Is inferior to the diaphragm. So this is a very important TEAS questions, the anatomical location of different cavities. Superior to the diaphragm is the thoracic cavity, and abdominopelvic cavity inferior to the diaphragm. So what are the organs remain present within the thoracic cavities? Do you know any organs? The
Lungs.
lungs in bit, let me draw the lungs. Okay, this is the two lung. Now, do you know the space between the lungs? This space is known as
Mediastinum.
mediastinum. Good. So what is this organ in between the lungs?
The heart.
Heart.
The heart. So these are the organs remain present within the thoracic cavity. Now, relative questions, location, let's see. This is the thoracic cavity. Now, abdominopelvic cavity is divided into abdominal cavity, abdominal cavity. So what is the organ, for example, in the abdominal cavity?
Stomach, intestines.
Good, absolutely correct. That is the stomach, even the liver,
The spleen.
intestine, spleen,
Gallbladder.
spleen,
Pancreas.
pancreas, gallbladder. Okay, now let's see. The spleen is superior to the lungs. Is it true or false?
False.
Okay, lungs, please. Lungs in the thoracic cavity. This is the lungs, spleen in the abdominal cavity. Now, relative relationship. Spleen is superior to the lungs is a false. That
False.
means
False.
is correct. Spleen is inferior to the lungs. Inferior means below. So the heart is inferior to the stomach. That is false. So heart is superior to the stomach. So this relationship is very important. The relationships between the cavities or relationships between the organs. And then the pelvic cavity mostly contains the reproductive organs and the urinary bladder. Is it clear? The body cavities?
Yes.
So these are the form of questions pattern. The organs superior to diaphragm, organs inferior to the diaphragm. So these are the questions pattern. Now, abdominopelvic regions, you know, uh, the abdominopelvic cavity is divided into, can you remember how many regions?
9.
9 regions. Good.
I'm sorry, Professor. Can you
And
please go back to that slide? I was.
yes, sure.
I'll just take a picture.
Yes, sure. And I uploaded this into the chat box. Okay. Okay. Now the questions. Why these regions are important? Why should we know the regions? You know, to assist in locating the medical problems with greater accuracy and for identification purpose, the abdomen and pelvis divided into 9 regions. That is very important for identification purpose. So what are the regions? You can see this is an umbilical region, and superior to the umbilical region is called epigastric. Superior to the umbilical is epigastric, and inferior to the umbilical region is the hypogastric. Now you can see the relationship superior, inferior, and then on that's both right and left side of epigastric is called right hypochondriac and the left hypochondriac. And the right and left side of the umbilical is the lumbar, and right and left side of hypogastric is right and left ilia. So these are the 9 regions. I already mentioned to assist in locating medical problems with greater accuracy and for identification purpose. Abdomen and pelvis divided into 9 regions. So these regions are abdominal regions. I think these regions often used in relation to physical examination and medical history to describe the signs and symptoms. You know, physical examination means healthcare professional examine the manually. So these regions are used in relation to physical examinations. that is abdominopelvic regions. There's a 9 regions. Now the quadrant, abdominopelvic cavity, again divided into 4 quadrants. Quadri means 4, and this is also important. This divisions to locating the medical problems with greater accuracy, to locating the pain, or even this quadrant used by healthcare professional to specify the location of pain, even incision during surgery. What is incision? Do you know this medical term? Incision means?
Opening.
Yes,
Into.
yes, surgical cut or cut into. Good. So location of pain, incision, and many other uh, uh, physical examination. So therefore, these quadrants are very, very important. So you can see here the quadrant. We can make 2 imaginary line that divide the abdominopelvic cavity into 4 quadrant. So this is umbilicus, and you can see the perpendicular line, and this is the right upper quadrant and the left upper quadrant on the right and left, and then the right lower quadrant and left lower quadrant. Now you can see the 4 quadrant. Now, can you identify important organ into right lower quadrant? Can you see the important organ in the right lower quadrant?
Liver.
No,
Liver.
this is the right. No, the liver into the right upper. This is the liver.
Oh,
In the
appendix.
lower appendix. Appendix. Now, you, for example, you are working in hospital, and especially in the emergency, you find a patient complaining the pain on right lower quadrant. So the which organ possibly inflamed? Appendix. So appendicitis, patients complaining pain into the right lower quadrant. Now, if you find any mass or pain in this area, right upper quadrant, that radiate to the back, probably, can you see the green color structure here? Green color?
The gall.
So the gallbladder.
Yes.
So the gallbladder pain on this area.
Mhm.
So therefore, this quadrant is important to specify the location of pain. Is it clear? And you can see the left upper quadrant, the most important organ is the
stomach.
The stomach. So the stomach related problem will be in this area. If you can palpate any tumor, it could be from the stomach. Is it clear? So this, the quadrant is provide either to specify the location of pain, or even we can, for example, appendicectomy. Physician give incision in this area, right lower quadrant. They don't touch upper or middle. So just use this area. Okay, good. Any questions about this directional terms? If no, now let's start some questions and exercise, because this is a workshop, so we'll discuss some problems now. Okay, where is the questions? Where are the questions? Let me open. Okay, can you see the questions?
Yes.
Okay, thank you. Let me zoom in. Where is the zoom in button? How to zoom in here. And now is it clear? Is it okay, right?
Let's
Yes.
move to the side. Can you? Thank
Now
you.
it's okay. Welcome. Okay, let's. The first questions: the thoracic cavity lies abdominal cavity.
Superior.
C.
Yes, superior to abdominal cavity. Superior means above. Now, if you can think the questions in different way, the abdominal cavity lies inferior to the thoracic cavity. Is it clear the relative relationship? Okay. Now, number 2, the upper mid portion of the abdomen is called?
Epigastric.
Yes, epigastric regions, epigastric. Sometimes we call the epigastric pain, right? So that is, the acid reflux, patients complain the pain in this area. So that is upper mid portion of the abdomen. Oh, okay. When the body is placed in the anatomical position, which of the following is not true?
The body is
The
erect.
B.
C. B, sorry.
Yeah,
B,
B.
correct. It's an incorrect. Can you correct this one? The palms are facing
Forward.
Forward.
correct. Palms are facing forward, not backward. Good. Okay, great. Anatomical terms. Number 4, the anatomical term that indicates a structure close to the surface. Close to the surface.
B. Proximal.
Okay.
Superior.
So no, let me explain this question, sir.
Superficial.
Superficial.
Yes,
Superficial.
superficial. Okay.
Oh,
Now the
superficial.
question,
Yeah,
why
yeah,
not anterior? Anterior means front.
Front.
Why not proximal? Proximal means near.
yeah.
Near.
Why not superior? Superior means above.
Above.
So superficial means close to the body surface. So any structure that is close to the body surface, we call superficial, and deep to the body surface is deep. So when we explain the structure, sometimes we use superficial structure and the deep structure. Superficial structure means that is close to the body surface, and the deep structure that is deep to the body surface. Is it clear? Superficial and deep.
Yes.
Yes.
Good. Number 5, a directional term that means the same as posterior.
Ventral.
Dorsal.
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 Same as posterior means dorsal. Okay, so correct answer. And the directional term that means the same as anterior is the ventral. Remember, anterior and ventral means the front, and the dorsal and posterior means the back. Clear?
The
So anterior and ventral is synonyms. That means the front, and the posterior and dorsal means the back. The body parts that are described as the medial are considered to be the medial.
Midline point.
Yes, that is closer to the midline of the body. Okay, now toward the head. What will be the term? Cephalad. Cephalad. AD means toward. So the toward the head is cephald. I think you learned in the medical terms. So the cephald means toward the head. Let me write it here. Okay. CPH. Okay. Cephal. You can see here, cephalo means head, and AD means the toward. So means toward the head. That means the upward. So cephal. Okay. And the toward the front.
Anterior.
Anterior. And closer to the point of origin. Closer to the point of origin.
Proximal.
Proximal, correct. Good. So that is the proximal. So, but the correct answer is here, closer to the midline of the body. Great. Select the appropriate directional term to complete this sentence. The mouth is to the nose.
Inferior.
Mouth is inferior to the nose. Correct. I'm sorry, I have to. So the answer is inferior means what is inferior?
Below or under?
In, inferior means the under, correct. Okay. So now, if the question is nose is, then the nose is inferior to the superior to the mouth, right? Nose is superior to the mouth and the mouth is inferior to the nose. Good. Select the appropriate directional term to complete this sentence. The skeletal muscles are the skeletal muscles. Now you can see the relative relationship between the muscles and the skin.
Is that deep?
It was deep.
Mhm.
Yes, deep, correct. So skeletal muscles is deep to the skin. Deep means inside. Now, if you can think the questions in the different way, the skin is superficial to
Mhm.
the skeletal muscles. Now, you can see when you find this type of questions or you solve questions before you take this test, just think all the probable questions. So the questions is skeletal muscles are deep to the skin. If we can think skin is superficial to the skeletal muscles. Okay. A plane that divides the body into superior and inferior parts is known as
Mid-sagittal plane.
superior and inferior.
No, transverse.
Transverse.
Transfer.
Yes, correct. Then transverse. So the transverse. The mid sagittal is divided into the right and left half. So the
Oh, yeah.
transverse divide into superior and inferior. So what is frontal?
Anterior
Anterior.
area.
Yes, that is anterior. And what is parasagittal? Parasagittal. Okay, let me write it here. Sagittal means,
Mhm.
that is the passing through the body, dividing the body into the right and left side. That is sagittal. And what is parasagittal?
Oh, para is around.
No, parasagittal.
I don't
The
know.
the parasagittal means dividing the body, uh, from into unequal
Oh, okay.
left and right sides.
Mm.
So this is then parasagittal. Mid sagittal means equal half, but the parasagittal means unequal.
Unequal.
Is it clear? The parasagittal,
Yes,
that
thank
is
you.
unequal left and right sides. So this is the best way to prepare yourself for TEAS prep, TEAS exams. When you can find any problem, try to answers and find the answers, all the options. Is it clear, the parasagittal?
Professor, can you say parasagittal again? Dividing the body.
Oh, that is dividing the body into equal. Okay. Now,
Unequal half.
yes, unequal. You can see the unequal left and right. Now, okay, I think it will be clear if I write the mid sagittal.
No, it's fine.
Mid sagittal means what is mid sagittal?
Equal left and
Yes,
right.
yes, dividing the body equally into left and right sides. Is it clear the difference between parasagittal and mid-sagittal?
Yes.
That is
Yeah.
equally, and the parasagittal is unequal. Okay, good. What major organs are housed in the thoracic cavity?
Is it A?
Mhm.
Yes, that is the, okay. The lungs, heart, esophagus, and the trachea. So what about the stomach, intestine, liver? Is present within which cavity?
Abdominal cavity.
Abdominal cavity. And what about urinary bladder and reproductive organs?
Rib
The pelvic.
pelvic cavity.
Pelvic cavity, correct. And what about brain?
Cranium cavity.
Cranial cavity, good. And what about the spinal cord?
Thoracic.
No,
The spinal
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 cavity.
cavities.
Spinal cavity. So the spinal cord, if you can see here,
Okay.
so this spinal cord in the spinal cavity, brain in the cranial cavity, heart, lungs into the thoracic cavity, urinary bladder and reproductive organ in pelvic cavity, and digestive organs in the abdominal cavity. Good. What smaller cavity within the thoracic cavity houses the heart and the red blood vessels?
What smaller cavity?
The mediastinum.
The
Medium.
mediastinum. Now, what is mediastinum? If you can recall the mediastinum,
Breastbone.
no. Mediastinum is not the breastbone. Let me draw. I think it's in the thoracic cavity. If you can highlight this cavity, contains. Can you identify these organs?
The lungs.
Lungs.
The lungs.
lung.
Yeah. Can you see the cavity or space in between the lungs?
Mhm.
Yes.
This is called mediastinum. So what is mediastinum? A space between lungs. Is it clear? And
Yeah.
this space contains the heart. This is the heart and the aorta, the other large blood vessels.
Mhm.
Is it clear? The mediastinum is the space between the lungs.
Mhm.
Yeah.
So this is the, okay. Number, the patient complaint of superior to umbilical region or the pain. Superior to umbilical region, superior to umbilical regions.
Iliac.
Okay, I think you can
Epigastric region.
epigastric, correct.
Yeah.
You can
yes.
see this is the umbilical. If you can see the umbilicum, sorry. This superior to umbilical is epigastric. Epi means above. Epi means above. Hypo means below. So above the umbilical is epigastric. And so if you cannot find the, just forget the correct answer, try to find the prefix. Epi means above, so superior means above. So that is umbilical and hypo is the below. Is it clear?
Yeah.
So the correct answer will be epigastric.
Epigastric.
On the right and left side of the epigastric is called hypochondria. And inferior to umbilical is hypogastric. Hypogastric is inferior to umbilical. Okay. The ears are lateral to the eyes. Is it true or false?
True.
Yeah,
Is it
true.
correct? What's wrong? That is the true. Lateral means side. I think these questions we discussed earlier. That's the incorrect answer. Okay, I think there is few more questions that let me open this, not the correct one. Where is those questions, please? Okay. Sorry, just let me open because we are more
Professor, we
important
can,
to
is
me.
there a way we can go back and listen to this video?
Yes, yes.
Okay,
Can
thank
you-
you.
Okay, I think this is the. Okay, now we completed here this up to the years. Now I open another questions.
Mhm.
Okay, from here, number. In the human body, which of the following body parts are superior position to the lungs?
The trachea and the brain.
Yes, superior position is then
Mhm.
superior means above the trachea and the brain. What about a stomach? Stomach and spleen?
Mm-mm.
Inferior.
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 Inferior. Because the stomach is within abdominal cavity and the spleen is also abdominal cavity. So these are inferior. And what about the heart? Heart
The
in between the lungs. In between the
medial.
lungs. In
Mhm.
between the lungs. That is called mediastinum. Which terms add clarity to anatomical position relative to the coronal plane? Think
Oh, is C.
It's inferior.
yes.
Posterior.
Anterior and
Anterior.
posterior.
Because the coronal plane dividing the body into anterior and posterior. Anterior
Posterior.
means frontal. What about which plane dividing the body superior and inferior?
Transverse.
Transverse, superior and inferior. Good. And what is distal? Distal means away.
Away.
Away
Proximal means near.
Ne-
to us.
Now, which plane dividing the body into the left? Oh, sorry. Lateral means side and medial means middle. Okay, good. Okay, I think we discussed the ear are lateral to the eyes. That is the true. So lateral means on the side. And if the questions that eyes are medial to the ears. Okay, so both are correct. Eyes are medial to the ears. Which of the statement below is accurate? Select all that apply.
The auxiliary region is superior to the systolic region of
B.
coronation.
Is it C?
Yes,
C,
yes,
yeah.
yes.
C.
C and B is
No.
accurate too.
C is a correct and B correct. A.
Mm-mm.
Now let's explain first why A is incorrect. Axillary region. Axilla means the armpit, right?
Yeah.
Yeah,
The armpit and cephalic means head.
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 So
Mhm.
armpit is inferior to the
Head.
so that is incorrect, not superior. It should be inferior. Clear? Now the D is incorrect because the axillary brachial. Can you remember what is brachium?
The arm.
Bicep.
Arm. And brachium means arm. What is antecubital?
The
Front
elbow.
of the elbow.
Elbow.
What is antebrachial?
Back of the arm.
Back up. That's the forearm. The forearm is antebrachial.
Oh.
What is popliteal?
The knee. The back of the knee.
Knee. Back of the knee. And
Mhm.
what is sural?
The calf.
Yes. The
Yeah.
sural
Oh.
means the calf. Correct. So these are associated with the upper limbs. No. The popliteal, sural, these are the lower limbs.
Mhm.
Remember, these two are the lower limbs, popliteal and sural. Axillary, brachial, antecubital, and antebrachial are the upper limbs.
Mhm.
So these type of questions are important for these exams. So you can easily, so axillary, brachial, antecubital, and antebrachial, these are associated with the upper limbs, and popliteal and sural is associated with the lower limbs. Sural means, what is sural?
Calf.
Calf, correct. Good. You can
Okay.
see here the description. Let me do. The sural means the calf. This is the sural. Good, appreciated. Now the question, the oral, nasal, buccal, ocular, or anterior to the occipital regions. Anterior means
Front.
front. Now you can see here the nasal, the nasal means the nose, and
Mhm.
you can see here the oral means the mouth cavity. And what is buccal?
The cheek.
Yeah. No.
Yes, correct.
Okay.
Buccal, actually, relating to the cheek, correct. Buccal means cheek. Now, ocular means
The eye.
Eyes.
eye. So, occipital, which is the posteriorly. So these three structures all are anterior to the occipital. If you can see here, this is an occipital on the posterior. So these all are anterior view. Is it clear now?
Yeah.
And now the digital or phalangeal may be pedal or manual. Pedal means foot.
But
And what is manual?
Hand.
Yes. So the manual means your the pedal means feet and the manual is hand. So the digital and phalanges may be pedal or manual. Is it clear?
Yes.
So select the letter that in the TEAS exam, you'll not find this type of questions. But anyway, I just add this one to explain the regions in the body. Let's try to answer these questions. Okay, just let me zoom out. Okay, sorry. Now, select the letter that represent the left iliac. Left iliac.
Mm,
it'll be C.
D.
Yes, the left iliac. Now you can see here. Look, this is the umbilicus. Then superior to umbilicus is your epigastric, and this is hypogastric. These are the lumbar. And now the questions is C or D. So you can see that these are the iliac. Now, which part representing the right side of the body?
Oh, okay. So D is the right side.
D
Yes,
is
the D is the right side.
C
And
is the
C is
answer.
C is the
correct.
correct answer. So C is the correct answer. So that is
Oh.
the left iliac. So, when you see an image, that will just opposite. So the right side in your left hand and the
Oh.
left side will be in the right. So you can see another way. You can see the liver. The right lobe of the liver is the larger. If you can see here that this is the right side of the liver, which is larger than the left side. So this is another way.
Oh.
Okay. I think that's the end of today's. We complete the chapter 1. And any questions, please?
No.
Very good.